Hi there. I need your help taking a patient's temperature. This is Carla. I confirmed her identity and explained the procedure, and she gave consent for us to continue. Always follow established safety, hygiene, and infection prevention policies and procedures. Before we begin, let's perform hand hygiene. Point to the hand hygiene button and press the trigger. You can measure temperature at multiple body regions, including the head, upper torso, and lower body. We'll discuss 4 common methods of measuring temperature. Starting with oral. It's very common to take temperature orally, but there are situations where you'll avoid it. For instance, you would use a different method if your patient was coughing, unable to close their mouth for an extended period of time, unconscious, or heavily sedated. Food, water, and oral care can affect mouth temperature. Before taking a measurement, ask Carla if she's had any of those in the last 15 minutes. Using your controller, point to the Talk to Patient button and press the trigger. Select what you want to say to Carla. Select the Submit button. Have you had anything to eat or drink, or have you brushed your teeth in the last 15 minutes?
No.
Next, ask if Carla has recently taken any medication that could affect her temperature. Have you taken medication for reducing pain, inflammation, or fever today?
No, I have not taken any yet today.
Great. Thank you, Carla. Avoid taking temperatures for about 6 hours after administering a medication that lowers temperature, unless you are specifically observing its effectiveness. Since Carla has not taken any medication that could affect her temperature today, we can continue. When taking an oral temperature, you'll place the tip of the thermometer's probe in the back pocket under the tongue on either side of the mouth. Placing it in the front of the mouth will cause a lower reading. The thermometer tip needs to be placed here under the tongue and at the back of the mouth. It's time to take Carla's temperature. First, draw the curtain to give Carla some privacy. Point to the curtain and press the trigger. Good job providing Carla privacy. Now, look at the thermometers. Oral and rectal thermometers can look similar to each other. They are typically differentiated by a label or color coding system. This facility color codes green thermometers for oral use and red ones for rectal. Use the grip button to pick up the oral thermometer. I'll put away the other one. Touch the thermometer to turn it on. See the icon at the bottom left of the screen? The text and flashing head indicate that the thermometer is set for oral use. The letter C at the top right of the screen means it's set to measure temperature in Celsius. We'll chart in Fahrenheit, so we need to change it. Change the thermometer to Fahrenheit mode by touching it with your free hand. See the probe at the top of the thermometer? It's tethered to the thermometer by a wire. Grab the probe. Slide it out of the probe well. That's the slot that the probe is stored in. Probe covers should always be used for thermometers you will use again. If you're working with a single patient use or disposable thermometer, you can skip the probe cover. There is an open box of covers on the back of the thermometer. Insert the probe into the box to attach a cover. Remove the probe from the box. Put the thermometer down on the bedside table. I'll make sure you can still see it. There you go. You need to establish consent for any interaction with a patient. Ask Carla to open her mouth. We're going to take your temperature now, okay? Please open your mouth. Gently place the probe in the back of her mouth, under her tongue. Hold the probe in place. The thermometer will beep in 10 to 15 seconds when the reading is complete. Look at the thermometer display. Her oral temperature looks good, 98.6 degrees Fahrenheit. I'll write that down. Ask Carla to open her mouth again. You can open your mouth now. Gently remove the probe. Time to dispose of the probe cover. The blue button at the end of the probe ejects the probe cover. Aim carefully. The cover may not fly off where you expect. Hold the probe over the trash can. Press the trigger to release the cover. Nice shot. Slide the probe back into the thermometer's probe well. Perfect. I'll put it away. Next, tell Carla her temperature. Your oral temperature is 98.6 degrees Fahrenheit. Next is rectal temperature. Rectal temperature measurement yields more accurate results, but is rarely performed in adults because it can cause rectal perforations and tears. Ask Carla for permission to perform this procedure. Would you feel comfortable with us taking your temperature rectally? The provider requested we use a highly accurate source.
I'm sorry, I'm not sure if I feel comfortable with that.
That's completely okay. It's within your rights to refuse. We can take your temperature another way. It's fine if a patient refuses consent like this. You just need to take note of it while charting. Before using another method to take Carla's temperature, I'll explain the rectal procedure. Pick up the rectal thermometer. Take a look at the probe well. The probe well is colored red on this thermometer to indicate that it is meant for rectal use only. Put the thermometer down on the bedside table. I'll put it away. Here's how you would perform the procedure. First, we move the patient into Sims position, like this. One leg is extended straight out. The other is bent at the hip with the knee up towards the chest, supported with a pillow. Ensuring patient privacy and dignity is extremely important, so you'll only expose the necessary areas of the patient's body. Use linens or towels to cover other body parts. Gloves are recommended for this procedure. Open a single-use packet of lubricating jelly and apply a small amount to the thermometer probe cover. Lift and separate the buttocks to visualize the rectum. Be sure to inform the patient before touching them in the rectal area or inserting the thermometer probe. Then insert the probe 1/2 inch to 1 inch, stopping if any resistance is met. Cover the buttocks region while waiting for the thermometer to beep. Once the temperature is obtained, gently remove the probe. Wipe away any remaining lubricant from the rectal area and cover the buttocks. After the procedure, discard the probe cover, clean the thermometer, discard the gloves, perform hand hygiene, assist the patient into a comfortable position, and record the temperature. Next is axillary or armpit temperature. If a patient is unable to follow instructions, this is one of the easiest and least invasive methods of taking a temperature. Avoid this method if your patient is sweating noticeably. This can affect your temperature readings. To take an axillary temperature, place the probe tip in the middle of the armpit. It should be touching the skin. The thermometer tip needs to be placed in the middle of the armpit. Now, it's time to take Carla's temperature. To get an axillary temperature, we'll need to expose her armpit. The curtain is already drawn for her privacy. Before we begin, let's perform hand hygiene. Point to the hand hygiene button and press the trigger. We need access to Carla's armpit. Ask her for permission to touch her arm and unbutton the snaps on her sleeve. We're going to take your temperature at your armpit now. Is it okay if we adjust your arm and unbutton your sleeve?
Sure, that's okay.
Great, thank you. Touch your sleeve to unbutton it. Pick up the thermometer. Touch the thermometer to turn it on. This one needs to be configured for axillary use. Touch the thermometer to change modes. Grab the probe. Slide it out of the probe well. Insert the probe into the box to attach a cover. Remove the probe from the box. Put the thermometer down on the bedside table. I'll make sure you can still see it. There you go. Touch Carla's arm to adjust it. Gently place the probe in the middle of her armpit. Lower her arm by hold the probe in place. The thermometer will beep in 10 to 15 seconds when the reading is complete. Look at the thermometer display. Her axillary temperature looks good, 97.9 degrees Fahrenheit. I'll write that down. Ask Carla to lift her arm. Please lift your arm. Gently remove the probe. Touch her sleeve to button it up. Time to dispose of the probe cover. Hold the probe over the trash can. Press the trigger to release the cover. Nice shot. Slide the probe back into the thermometer's probe well. Perfect. I'll put it away. Tell Carla her temperature. Your axillary temperature is 97.9 degrees Fahrenheit. Next, we'll measure Carla's tympanic or ear temperature. Tympanic thermometers obtain temperature quickly, but may require extra practice to use accurately. If a patient has excess earwax or is wearing hearing aids, a different method should be used. To take a tympanic temperature, pull the top of the ear up and back to open the ear canal. Then place the probe tip in the ear canal. Be careful not to force the probe further than it naturally goes. The thermometer needs to be placed in the ear canal without forcing the probe further than it naturally goes. Now, time to take Carla's temperature. Pick up the tympanic thermometer. Good. Touch the thermometer to turn it on. This thermometer's probe covers are in the base. Slide the probe into a cover to attach it. Perfect. Now, have Carla turn her head so we can take her temperature. We're going to take your temperature now. Would you turn your head for us so I can insert the thermometer into your ear? You'll need to touch your ear, so reaffirm consent before proceeding. May we touch your ear?
Yes, that's fine.
Thank you. Touch Carla's ear and I'll lift it up and back. Gently place the probe into the ear canal. Right. The tympanic thermometer start button activates it. Press the trigger to use it. Hold the probe in place. The thermometer will beep in 10 to 15 seconds when the reading is complete. Gently remove the thermometer. Look at the thermometer display. Her tympanic temperature looks good, 98.2 degrees Fahrenheit. I'll write that down. This thermometer has a probe eject button above the display. Hold the probe over the trash can. Press the trigger to release the cover. Nice shot. Attach the thermometer to its base. I'll put it away. Tell Carla her temperature and let her know that you'll need a minute to chart it. Your tympanic temperature is 98.2 degrees Fahrenheit. Give us a minute to chart that. Before charting, you'll need to ensure Carla's safety. We'll start by raising the side rails, then we'll place the call light within reach. Touch the bed's side rail and I'll help her get situated. Before we begin, let's perform hand hygiene. Point to the hand hygiene button and press the trigger. We need to chart the temperature on the electronic health record system. Point to the workstation on wheels and press the trigger. Use the trigger button to type the oral temperature in the chart. Select Carla's oral temperature is 98.6 degrees Fahrenheit. Use the trigger button to type the axillary temperature in the chart. Select the Save button to record your response. Carla's axillary temperature is 97.9 degrees Fahrenheit. Use the trigger button to type the tympanic temperature in the chart. Carla's tympanic temperature is 98.2 degrees Fahrenheit. Always document according to your facility's guidelines. Great job taking and recording Carla's temperature.